Okay, so how we're going to do it today. First of all, I'm going to talk about why actually do work experience. What is the point? Obviously, you need it to get into medicine, but it's really important to actually take stuff away from it as well. The next thing, I'm going to talk about Warwick entry requirements specifically, because they have quite stringent requirements. So anything that Warwick would accept, most unis would also. So yeah, I'm going to speak about that. Then we're going to do a quick Q&A, and just to talk about anything that I've spoke about. And then in the second half, we're going to talk about how to actually get work experience, talk a bit about paid role and jobs, and then we're going to do a Q&A. And we have 4 other medical students joining us, Katie, Banu, Marianne and Callum, and we all have different work experience, so that'll be a really good opportunity to ask any questions you want to about our experience getting work experience. Okay. And the recording is going to be put on YouTube in the next coming weeks. So if you have a question throughout and you want to answer it anonymously, you can scan this code and it will take you to a Google form. And then what we'll do is, when it is time to answer any questions, we'll go through the Google form and answer them all. You can also just ask a question in the chat if you would like to, or you can raise your hand and say it out loud. But yes, if you scan this, it'll take you to the Google form. So I'll just leave it a second. You want to scan? Okay. So why is work experience important? I think being a doctor is one of those professions where everyone looks up to it, and it's very well thought of in society. But there is work. Being a doctor isn't all smiles, and it isn't a glamorous profession. So it's really important to gain experience of what it's actually like to be a doctor, and understand the difficulties, so it can be emotionally, physically and mentally exhausting. You're dealing with ill people every day. You might be helping people get changed. You need to be a certain sort of person to want to do it. Also, there's a work-life balance. You're going to have to work nights, weekends as a foundation doctor. So it's really about doing work experience to see if it is actually something that you want to do. So and I am reusing this slide from my first talk, but don't just use work experience as a tick box requirement. It's really important to take things from it. So if you think, what sort of doctor would you want to treat a family member? Obviously, the good ones are in green, the bad ones are in red. It's really important to think about when you're doing work experience, or you're doing your job, which you're using for work experience. Make sure you're thinking about what you've seen, which went well or didn't go great, and make sure you're reflecting on that experience and how it might apply to your career in medicine. So reflecting is really important in medicine. We have to do reflections all in the year to submit, and you have to do it throughout your whole career. So med schools will love it in the interviews and in your personal statement if you're able to think of a situation that went well or didn't go well, and think about how you would change it for the next time, and just really think about what you took away from it. Yes, okay. And also, I would recommend to keep a journal. Make sure you're writing experiences down, because this will be so helpful when you're doing your personal statement, when you're doing your interview. But make sure you're maintaining confidentiality. Don't include any specific patient details which would make them identifiable. So you wouldn't include a name or anything like that. Okay. So I'm going to speak specifically about Warwick Graduate Entry Medicine first, just because we have quite stringent work experience requirements. So you need 70 hours of hands-on care of patients across a minimum of 2 placements, and there's a maximum of 50 hours per placement. So for example, say if you're a nurse and you've got hundreds of hours doing being a nurse on a certain ward, that would only actually count for 50 hours. So it's important that you have that 20 hours elsewhere, whether you find that in shadowing a different ward or doing some other volunteering. And also, shadowing only counts for a maximum of 20 hours. So some people will get really cool work experience like observing a heart surgeon, but this actually only counts for 20 hours. Because shadowing allows you to see the challenges of being a doctor and see the day-to-day life of a doctor, but you're not actually getting that experience yourself. So Warwick really like you to have more hands-on experience rather than shadowing, so that's why it's capped at 20 hours. Also, just something to bear in mind, because of COVID, they've changed the work. So it used to be you could count the dates from the past 2 years, but now it's 4 years because of COVID. So anything from the 15th of October 2017 to the 15th of October 2021. Okay, so what is hands-on care? It can seem a bit of a grey area, especially when you're doing work experience, but they refer to it as, so this is from Warwick website, so the term care specifically refers to the act of carrying out tasks that directly assist, benefit people or patients with their healthcare needs. So it's really important that you're doing things with people with healthcare needs. So it doesn't count if you've taught or you tutor, that doesn't count. And it can't be friends or family. So even if you care for your family, unfortunately, it doesn't count. So Warwick requirements. So you must have worked as a caregiver, providing direct hands-on care with patients with healthcare needs, which is the key bit. And they also want you to have experience in a healthcare environment, ideally of the NHS in primary and secondary care environments. So that is your GP and your hospital. So for that, you can either do a paid role in a hospital, or you could volunteer, or you can do your shadowing. Okay, so examples of these roles. So working as a caregiver to people with healthcare needs, that can be in a care home. It can be home care for unwell patients. It could be shadowing a doctor or a healthcare professional, but that's capped at 20 hours, remember. You can be a healthcare assistant. That's a really good way of getting lots of hours in. And usually you don't need any qualification to be a healthcare assistant. And so you can be a physician's associate. You do need a qualification for that. And also any allied health profession like nurse, physiotherapist, paramedic, that all counts as well. But obviously you would need a qualification to do that first. Warwick's added in something about pharmacy graduates. So we have quite a lot of pharmacists on our course. So if your primary work experience is within pharmacy, then you must have a second experience outside of pharmacy, which also demonstrates hands-on care. So if you're a pharmacist, that's something to bear in mind. Okay, so what doesn't count at Warwick? So any experience where you're not providing healthcare, direct hands-on care for patients with healthcare needs. So it can't be childminding, it can't be a sports coach, it can't just be for caring someone, they need to have healthcare needs. Any lab work, that doesn't count. Any form of teaching, that doesn't count. Any marshalling, stewarding an events, doesn't count. Charity work, so if you've worked at a shop or you're fundraising, that doesn't count. And these next couple are in green, and that's because they've slightly changed. So usually these don't count. So usually a non-caring role within a healthcare organisation doesn't count. Being a first aider or member of First Aider Association like St John's Ambulance, usually that doesn't count, and neither does a call centre operative. But because of COVID, they've actually added so the dates need to start from the 1st of February 2020, but these also count now. So you can be an NHS 111 operative. You can work as long as you're patient facing in a hospital, and you fall under the key worker category, that counts. St John's Ambulance counts this year as long as you've got logged evidence of hands-on care provided. So you need to make sure you're getting evidence. They've added Nightline, Samaritans and Good Sam. So Nightline and Samaritans are like a a phone call service. Sometimes if you're experiencing difficulties with your mental health, you can call them, and basically it would be talking to the person who's experiencing these difficulties. And I think you can get a lot from that. If you're talking to someone who's going through crisis, for example, as long as you reflect on that situation and how you spoke to the person and try to resolve the issue, I think it can be really useful. Good Sam is it's an app which is I think they're called NHS volunteer responders. So it's in combination with the NHS, and it's basically an app on your phone, and you can see people around the community where you live who need help, and it might be picking up medication and such, and you can do that as well. That counts this year. They do need to make sure it does involve healthcare provision and not just be, a chat. But this is actually capped at 20 hours, but you have to work 60 hours, which is a bit tricky because, you're doing 3 times work, but only 20 hours count. So that's something to bear in mind if you want to do that. And then, so the shadowing of healthcare professionals in an online format. So that counts this year for 20 hours. And also online mentoring programs related to healthcare and clinical practice delivered by qualified practitioners. That counts for 20 hours. But you need to make sure it's delivered by a qualified practitioner. So does anyone have any questions so far? You can ask in the chat, or you can ask on the Google form. So I'll just quickly say as well that I'll talk more after this about how to actually get the work experience. So if you just hold out on questions like that. I can see a question in the chat. Does Warwick offer undergraduate medicine? No, they don't. It's just a graduate course. How direct does experience need to be? Is it literally physical assistance? As a volunteer, you can't usually assist physically anyway. So, for example, I was a volunteer in a care home, and that would involve me. So I wasn't allowed to physically touch the residents because I wasn't trained to do so. So it doesn't have to be physical assistance. It just needs to be caring for them, and they've got healthcare needs. And just make sure you're reflecting on everything and take as much away from it as you can. You don't have to touch the patient to be able to take something from it. Is there a link we could get for the previous talk on finance? That's going to be on YouTube in the next few weeks as well. Does volunteering at vaccination centre count towards the 70 hours? Yes. I think it would. Just make sure you're reflecting on the actual patient care side of it rather than the actual just injecting with the needle. But it wouldn't count towards the full 70 hours. What activities would caring for them include? It really depends on the work experience you do. So it might be doing a ward round with tea and coffee if you're a hospital volunteer, but we'll hear a bit about that from some of our other medical students who have actually done that, and they can let you know. If you are a HCA already, can you pick up shifts on other wards? Will that count for 20 hours? So I think you could potentially do that, and make sure you just mark them as separate experiences, and just make sure you are getting different things from wards. It might be worth asking to shadow, or just so it's a different experience, but I think it would just make sure you're doing them separately. For virtual work experience shadowing, is there a maximum amount of hours needed? No. Well, you still need to meet the 70 hours requirement, and you're just gonna have to get 20 hours here, and then other hours from elsewhere. It might be a bit more difficult. Would Good Sam 20 hours, GP shadowing 20 hours, price and virtual experience count? So I think that would count because Good Sam has been added on this year. So GP shadowing would be capped at 20 hours, and then you've got Good Sam capped at 20 hours, but you need to do 60 hours. And then the Brighton virtual experience, that's also capped at 20 hours. So that would come up to 60 hours, but you've said additional healthcare support, so you could get for 10 hours elsewhere. Would you talking to it? So I think providing a parcels to patient service, that I think that would count. For volunteering at a care home, we're talking to residents, getting them a glass of water count. That's pretty much what I did. But just make sure you're, like I said, you're reflecting on it and you're actually getting things from it. Is it possible to be a HCA or study medicine at undergrad level? I'm not sure. I know people do it at graduate level, so I think it is possible. I've seen the Brighton and Sussex Medical School virtual work experience program. I think that would count because it's an official organisation. And then I've seen what is the best way to get opportunities. I'm going to talk through that now. You do need to provide proof of all your work experience, whether that's screenshots or they like you to have like a reference letter and a name contact. Make sure you've got the proof, especially for Warwick, as it doesn't count. Does the work experience you can pay for virtually count? As long as it's from a reputable company, I think it would count. So with Good Sam work experience, you have to, it says it a bit later, but in this talk, but you just need to provide screenshots of the hours or the amount of time you've worked. Okay, I'm just going to check the anonymous form. Goodness, a lot of questions. So what I'm going to do, because a lot of them are what counts, I'm going to talk through the work experience and how you can get it, and then it might be a bit clearer. And then we'll hear from the students as well at the end, so you can hear some examples of what we did. So where to get work experience? I think there's 3 main things you can do. So you can do shadowing, which is a bit more difficult this year. So that can be your GP or hospital. You can do volunteering in a care home or hospital, in a hospice, or you can actually do employed work. You can work as a healthcare assistant or a support worker. And this is the blue box is off Warwick website. So it says they really value voluntary work in a nursing home, care home, hospice or hospital volunteer, as well as a hospital, as well as employed roles as well in healthcare. So shadowing. So how I got my shadowing, I didn't know any doctors. So for my it might be a little bit different now, but if you're applying in the next couple of years or when COVID isn't such a thing, this might be more relevant. So for GPs, I literally wrote letters and emails to all the GPs in my area, and some got back to me and offered me work experience. If you think about the amount of GPs around, one is surely going to get back to you, and sometimes they don't check their emails, so that's why I wrote letters and people did get back to me. So I think that's one way of doing it. Hospital, applying through schemes, even ones, so if you're a graduate, even ones which say 16 to 18-year-olds still apply. That's because usually they'll quite like a graduate anyway. Also, you can email consultants directly. This is how I got my work experience in a cancer ward. It does see, so what you do, so this is off University Hospitals Birmingham website, because that's where I found my work experience. So, but all the trusts have these. They have like consultant directories, and you can go through and just find the area that you're interested in, and you can find the consultant, and then you can sometimes just do a search of their name and then find that. Or usually, so this is obviously not a real email, but usually the trust has a generic email address. So you find that email address, and then it's usually just their name with a dot in. And it is a bit of a sneaky way to do it, but to get work experience, but it does work if you email them directly and just say that you're really interested in their area of specialisation, and you really want to do work experience and you want to be a doctor. Though a few will get back to you. I think it's a good way in if you haven't got any contacts. There's also the applying through work experience scheme. So this is off UHCW, so University Hospital Coventry and Warwickshire website. If you scan this, it will take you to the application page, and all trusts have these. If you just type in the trust and work experience, then you'll come through with a similar sort of website. But I think it's important to bear in mind, if there's work experience which is virtual, the barriers of where you can actually do work experience has opened up, because you won't have to travel if you're doing it online. So I think it's worth looking at all the trusts that you can think of, working your way through and just applying for them all, and emailing them all. They've all got special work experience emails, so you know, they want you to apply. So that's another way of getting some shadowing experience. Okay, so what about in COVID times? So I touched on this before. You can do virtual work experience, so you can shadow virtually, or you can take part in a mentoring scheme. So what counts for Warwick, again, the shadowing of healthcare professionals in an online format, which is 20 hours, and online mentoring programs related to healthcare and clinical practice delivered by qualified practitioners. And like I said before, for anyone who's done that online work experience, or the experience such as Good Sam, if you're not able to get a letter, it says here, please upload an appointment to the role email and evidence such as screenshot of hours worked. Okay, so here's some virtual work experience that I've found. So this is SpringPod. So if you search this website, if you scan the QR code and go to SpringPod, then you can register your interest in this. And this counts for 10 hours. So this can count for 10 hours of your virtual work experience. So if you want to scan that, or you can just note it down, it's SpringPod, and you can apply for that. Okay, there's some more virtual work experience. So if you scan this QR code, it will take you to Birmingham Women's and Children's Hospital, because they have a really good page on virtual work experience. Not all of this might count for Warwick, but it might count for other unis. But these, I believe, will count for Warwick. So there's Observe GP, where you can observe a GP. There's Medic Mentor, and that is actually live work experience, and it's in combination with, I think it's Queen Elizabeth Hospital in Birmingham. So that's a really good opportunity. So I would apply for that one as well. Someone said before about Brighton, Sussex and Medical School Outreach. They're doing a virtual work experience program. If you just Google that or go on their Instagram. And also DWAMs. They are, okay, I think someone just sabotaged my presentation. 1 minute. Also, I'll just sort of, so Maz said about a non-caring role. Marianne replied about to Bethany's message about experience as a medical secretary. Now, usually this wouldn't count, but this has actually changed. As long as it's patient facing, this year it will count, and the hours have to be from February 2020. But I'll come on to that. Okay, so there's DWAMS, which is Dundee Widening Access to Medicine Society, and they're doing a virtual work experience scheme. So you can go on their Instagram or just search DWAMS on Google, and you can apply for their virtual work experience as well. So yeah, just make sure you screenshot and everything, and you've got evidence. Okay, so if anyone wants that, or you can just go on. If you Google virtual work experience, Birmingham Women and Children's Hospital, you'll go to that page also. Okay, so this is just a bit more about Good Sam. So if you want to apply to Good Sam, the QR code is on the top. If you want to be a Samaritans listening volunteer, make sure you're doing listening volunteer rather than just applying for Samaritans in a volunteer role, which doesn't actually involve healthcare provisions. So if you want to do that, you can scan the bottom code. There's also Nightline. If you want to be a Nightline volunteer, you have to contact your local Nightline branch. You can find that on the Nightline website. And anything similar to this, any listening services from an official organisation or charity, I think this would count also, but they are capped at 20 hours. Okay, so volunteering. So you can volunteer in a care home. You can volunteer in a hospital. So Katie and Marianne, they both, Katie volunteered in a hospice, Marianne volunteered in a hospital. So they'll be able to tell you a bit more about how they got that experience. These usually are only a couple of hours a week. So to amount your hours up, you need to make sure you're doing them regularly, because if there are only 2 hours a week, you might have to be doing it every weekend consistently. So just bear that in mind if you want to use volunteering towards your hours. I think the best way to go is employed work. The reason I say this is because there's less restrictions than volunteering. So when you're volunteering, you can't handle patients, you can't really assist with their healthcare in the sense where you won't be able to help them with medication, or you won't be able to help a patient eat or get them changed or help with personal care, where if you actually work in a paid role, you'll get the relevant training to do so. So a lot of people do healthcare assistant or healthcare assistants, and you can do that in a care home, in the hospital, or in the community. Be a support worker or a nursing home assistant. This year I've just added, because of the COVID-19 vaccinating, you can do that, but I would just bear in mind, like, think about how you've helped the patient and assisted with, think more about the patient contact rather than just actually doing the vaccine themselves, because Warwick at least would like people to focus on the patient contact. So this year, this is the little confusing that we had. So any hospital patient-facing support staff with dates from February 2020, if you're under the key worker category, that counts towards employed work. But just the dates have to be from February 2020. You must be a key worker and you must be patient-facing. So these are good because they're often flexible hours. You usually can get a 0-hour contract, so you could do it alongside your studies, or you could do it alongside another job. I had a full-time job, and then I worked with like a 0-hour contract as a support worker on the side. There's no qualifications needed, so anyone can do it. And if you think about how many care homes you see, there's lots of opportunities out there. So I've just seen, will they take an under 18 for a paid healthcare job? I think you'd have to inquire directly with the trust or the employer. And just make sure you get a letterheaded reference with a named contact, because if they want to verify the work experience, they like to go to a named contact. But obviously with the COVID-19 experiences, screenshots are allowed, just as long as you're proving that you've done it. And just finally, it's really important to reflect, think about what you've got from your work experience, what you've seen, what you did well, what you didn't do so well. It's really important to reflect on that, as it's so useful when in your interview and when you're writing your personal statement. Okay, so we're joined by Callum, Marianne, Katie, and Banu, and I've listed everything that we collectively did. So would it be okay if we just go around and we just talk about what everyone did? If someone wants to start. And you can ask any questions.
I'll start. Just bear with me.
Thanks.
Get my camera on, hang on. Hi everyone, hopefully you can hear me. Can you hear me, Kate? If you just give me a thumbs up. Brilliant. Hi, my name is Katie, so I'm also at Warwick and I'm in third year of third year medicine. So I did my work experience quite a number of years ago now, probably back in about 2016, 2017. And what I did was I did my 20 hours of shadowing. So that was with hospital consultants and in various different departments. So I did generally about 1 day with each person, because on the whole they were quite busy and didn't really want me to come for the week or anything. So how I went about getting that was at the time I lived in Oxford, and so I contacted the hospital in Oxford, and I also looked further afield as well. So I looked at Reading and Swindon, which were about an hour's drive kind of in either direction for me. Luckily I had a car, so I was able to do that. So that would be one tip that I would suggest. Don't necessarily just focus on your local area. If you've got access to a car, it would be great to kind of open up options by applying to hospitals that are maybe, you know, half an hour away, because it is feasible to do that for the day there and back. I found it okay. So I contacted kind of HR or the volunteers department at each of those places and just kind of explained my situation and found out what was available. There was a lot of groveling involved. There was a lot of phone calls and emails and stuff, but eventually I managed to get a foot in the door. In addition to that, so that was the 20 hours of shadowing. I also did 50 hours as a volunteer carer in a hospice for children and young adults with terminal conditions. And that was in Oxford. It was called Helen and Douglas House, like quite a well-known charity. I applied just directly through their volunteer scheme for sort of support workers. And that involved doing about 3 to 4 hours. Initially, I did about 3 to 4 hours a week. And then what happened was I got quite a bad mark in my UK CAT exam and decided it wasn't worth applying that year. So then I thought, right, I'll just sort of bide my time and redo the exam the year after. But that gave me a lot more time to be able to do the volunteering. So I then dropped down to about 3 hours a fortnight, because I just found I was working full time as well at the time in a different career, and I found full time work plus 3 hours a week of volunteering was just too much for me. So I dropped down to about 3 hours every sort of fortnight, every 3 weeks, and they were fine with that. But because I had like the 2 year, like an extra year kind of to do it, it all worked out fine. Yeah, that's me.
Thank you. Marianne, do you want to go next?
Yeah, hi everyone. So I did quite similar to Katie, but I just kind of did I sort of ticked the boxes, as it were. So I did shadowing in an oncology clinic for a few days, and I worked as a HCA, not for very long, just for a couple of months in neurology ward, and I also volunteered on a stroke ward during my undergrad degree. So I did that literally once a week for the whole time really of my undergrad degree, so probably like 2.5 years. And yeah.
Thank you. Okay, who wants to go next? Banu or Callum?
I'm happy to go next.
Thank you.
Hello everyone, so my name's Banu. I'm a second year medical student and the Buddy Scheme Coordinator at WHAM. So in terms of my experience, I started working as a receptionist at a GP centre, got to know doctors, and I sort of worked my way up to then become a medical secretary at the GP. At the time, I think I saw that in the chat as well, medical secretary was not allowed, but what I did instead is I used my time after work to shadow the doctors. So I accumulated enough, 20 hours, which was the shadowing limit, and used that as an opportunity to get my 20 hours shadowing there. I then also worked as a healthcare assistant at an oncology and palliative care ward in London. I did that for about a year, I think. The important thing with experiences is you need a primary contact that the university will be able to contact if need be. After that, or during that, I also managed to get work experience on an obs and gynae ward, or the whole department actually, for about a week. And again, the way it went back, that like Kate showed, I went on the website for my local hospital, looked for any emails I could find, literally per day. I'll just be sending about 30, 40 emails to random consultants. Usually what works is the consultants don't look at their emails. It's just something they don't do. But who does look at them is the medical secretaries. So usually the way it's listed is you'll have the consultant's email, And then the medical secretaries, it's definitely worth emailing the medical secretary asking for any shadowing or any work experience opportunities, even if their consultants don't do it, and they are the best point of contact as to who the best contact would be. So I did that, and I also worked as a medical secretary at Growell Hospital for a year too. So it was a variety of experiences, but again, wherever I could, I tried to shadow or squeeze myself in for some work experiences, because at the end of the day, it was literally all about networking and trying to get you contact. So once you find this one person, just see, even if you're working in a GP, in a hospital, the wards question. So HCAing, as long as you've got different points of contact for different wards, they could technically be counted as two separate experiences. You just need that main person to say how many hours you worked and that you were very hands-on. I think Warwick is very specific about that. They want you to sort of look after and care for the patient. I hope that sort of helps.
Yeah, that was brilliant. Thank you. Callum, do you want to go? To talk a bit about work experience.
Okay, can you hear me? All right,
yeah.
Wonderful. Hello everyone, my name's Callum. I'm first year medical student here. In terms of my experience, at undergraduate I worked just for a care agency doing sort of domiciliary care, which means you go into people's homes and care for them that way. So there's quite a few agencies out there that all sort of do similar things. Of failing to get into medicine about 3 times, I had quite a bit of time to accumulate my work experience. So I spent about just under a year working in trauma and orthopaedic theatres for the NHS. And then when COVID came, I was moved to intensive care for that time. And same as Kate, I did a few bit of shadowing with GPs as well. And I just sent a load of emails just with my CV, essentially saying I would like to study medicine and I need to get work experience. Bit of advice: make sure you send it as a blind carbon copy if you're going to send to a lot of GP surgeries, because if you send it as a CC, they can see that you've sent it to all the individual GPs, and it won't reflect well on you. So that's my experience.
Okay, thank you. Okay, so we can answer any questions now. So I know there's a bit of a debate in the chat about if you can get work experience as an under 18. Honestly, I'm not completely work a paid role when you're under 18. I'm not completely sure, because this is design. As being a graduate student, I'm not sure, but I think just contact the trust and have a look. But if not, you can apply to all these virtual work experience schemes, especially if you're doing undergrad. The work experience requirements aren't as much as a graduate. Okay, so for activities that you do for St John's Ambulance, how and what type of evidence do you need? I think you just need to make sure you are recording down the amount of hours you've done and exactly the care that you've done, because they don't like the fact that you say if you're at an event or something and you might not have actually done any patient care, you might just have been standing there, so they want a record of what you've actually done. On
that point, it's usually how, if you get the cover letter, like with the kind of work you've done, and then it's signed by your line manager or something.
Yeah, getting that name contact's really important. So how do you talk about work experience effectively in interviews? I think the key thing is to reflect on it. Just make sure you're thinking about the good things, thinking about the bad things, what you saw, which you want to take forward. Just make sure you're jotting down all your different experience which you think would be good to reflect on, and you can bring them up in conversation. Does working in a dentist or orthodontist count, as it's not a hospital setting? It's still a healthcare setting, but What would you say, Banny? Do you know?
Yeah, so, okay, I understand the point in the chat about the placements not being possible due to COVID, but because this is a graduate entry application, we would expect individuals here to already have a degree, and therefore you would at least at a minimum be 21. At 21, you will definitely be able to get jobs. So maybe not so with shadowing and work experiences, but with jobs, definitely so. And again, it depends on different places. I know most may say no, but it's slowly restarting now. So it's definitely possible. It's just going to be even tougher to get into. And again, as long as it's individuals, I don't see why not. St. John's Ambulance, for example, is definitely a great choice. And like Kate mentioned, I was with St. John's prior to med school. All I needed was my manager's letter to say how many hours I did. And the way it will help you in interviews is that the questions they will ask you are pretty much asking you to reflect on your experiences. So they would say, for example, can you talk about an experience where you worked as a team, or can you talk about an experience where you sort of brought in your own experience to the team, and these experiences are required. Basically, you need to show that you've been hands-on to be able to get the higher marks. Would you agree with that, Kate?
Yeah, I think that's a really good point. Because they'll know if you haven't done the work experience when you're in the interview, because you need to answer the questions on the work experience. So yeah, that's why it's so important to do work experience and actually think about it. Don't just do the work experience as a tick box exercise, actually reflect on it, so it will help you in the future. So I know there's a few questions in the chat about what age are they aimed for. I think undergrads can do it. I think grads can do it as well. Just if you go on the website and just register your interest, they'll let you know. So I've got lots of questions on the anonymous feedback form. So I'm a bit confused about whether all patient-facing NHS volunteering counts as when I emailed admissions. They said it was only feeding or washing, which is a bit difficult as I'm a volunteer. So I would say I have work experience counts where I was a volunteer, where you don't wash, or you just need to be caring for them. So that can be giving them a drink, it can be helping them with the food. It doesn't have to be personal care, I would say. What would you agree?
I mean, I remember emailing them the same question, and I remember admin saying, actually, no, it doesn't count. So the way I worked around it, though, is if you are definitely 21 plus and ask if you can get hands-on, then that sort of goes around it. Because I feel like as if it's just sort of giving them food and then talking to them, I don't think, especially Warwick, were very specific with their hands-on part. So they weren't allowing sort of the feeding and then the talking to patients criteria. They wanted to see you actually actively, physically caring for the patient, if that makes sense. But that might have just been my experience. Like you said, I think it's how you phrase it.
Yeah, I think phrasing it is really important, because if you just said like, oh, I went around with a drinks trolley, like that's not gonna work. But if you talk about how you spoke to patients, how you communicated with them, it's about how you reflect on it. So work experience abroad, I think that does count if you've got the letter from the consultant. I know someone who did that and got into Warwick.
Yeah, I had some work experience abroad, and as long as it's patient facing, you've got a headed letter, then it's accepted.
Okay, so I've got some questions on the chat. It says, is all virtual work experience capped at 20 hours, or do they count as 20 hours each? So I think it counts. So virtual work experience is capped at 20 hours, and then the mentoring scheme is capped at 20 hours. So I think you can do a mentoring scheme and virtual work experience as well, and that would count for 40 hours. But you can do loads of virtual work experience. It would just be capped at 20 hours. Is it 20 hours per person you shadow, or 20 hours shadowing in total? It's in total, so you can't that's it. So there's no point shadowing loads of people because it just doesn't count. If I do online work experience, how can I get a name, contact? There's no designated person. So I said before, like, you can get screenshots. Some online work experience offer certificates as well. So you can do it that way. I know, I think it's Mentor or Spring Pod, they do like a certificate. So that's good. Would I be disadvantaged when it comes down to my chances of getting into Warwick Medical School if I cannot get any paid roles such as a HCA? If you've got the hours, I would say, then no, but you'll be fine as long as you've got that hands-on care that you can reflect on and use for your interview. What would you?
Yeah, no, I definitely agree. I've got loads of friends who had no HCA experience, but they tick the boxes. I know you're not meant to tick the boxes because you will show in the interview, so you'll pass the criteria, but at the interview you'll get caught if there is no previous experience. But they all had some sort of hands-on experience to fit the 70 hours that are required.
Mm-hmm. I wasn't a HCA, and I'm here, so you don't need to be a HCA, because some HCA's roles are quite hard to get. So it might be worth looking in like a nursing home, because that all counts as well. They might be roles which are a bit easier to get. Yeah, I'll go through the links in a little bit. Who can I email to ask if my past experience is valid? So I emailed the generic general admissions email and I haven't heard back in 2 weeks. They are a bit slow, so you'll just have to wait. I mean, if you think about, has it met the requirements which I said in the presentation on the website, and you make sure you can reflect on it, honestly, it will probably count, I would say, but you'll get a response in the end.
I agree. If you wait another week and they don't reply, just call them. They don't know you, so just call and be like, would this count? Or is there maybe another email that you could email to where you would get probably a prompt reply?
Yeah, I think they are a bit slow anyway, Warwick admissions. But yeah, they'll get back to you in the end. If I'm currently teaching English to people with different disabilities, does that count as work experience? So that wouldn't count as work experience because it's teaching and not actually hands-on care. So you need to make sure you're actually caring and not teaching, not coaching. It needs to be hands-on care. What are some specific examples of jobs that can count for 50 hours? So healthcare assistant, support worker. You can do like domiciliary care like Callum did. You like go around to people's houses and they're very flexible shifts, and you just help with personal care and such. So there's them. So it says, would it count if I help out with the vaccination centres? I think it depends on helping out. It needs to be patient facing, and you need to make sure you're getting a lot from it. I think it's best to. I think it would count. What do you think? Do you think it would count?
What was the question? Sorry.
In a vaccination centre.
Yeah, I think it would. It should, because you are hands-on caring. It literally, again, the phrasing, just it's the way you're going to phrase the vaccinator role. So if you mentioned that you were talking to the patient, caring, taking consent, if that was part of your role, then yes.
So I know there's some things about for under 18. So this talk is directed to graduate entry, which is why we're talking about the hands-on care. It is a bit different. If you are under 18, it might be worth doing a virtual work experience instead. Okay. How would you effectively reflect on your experience? Does anyone want to answer that one?
Keep a diary, because it's so easy, especially if you're only doing like a week or 2 weeks worth of experience, especially with shadowing. You will forget what you did and what you learned by the time it comes to interview, 100%. So maybe you can have a diary, not of everything, but the main bits you did, where you maybe had a positive experience, where you worked as a team, where you saw something that sort of helped the patient, where you saw the NHS sort of coming together, a multidisciplinary team meetings, anything that you basically have seen and worked and you really liked, maybe. Definitely keep a diary. Anyone else?
I was just going to say exactly the same. I found it really helpful to just keep just like literally in a little notebook, I just wrote a few lines like after I'd had a particularly impressionable experience on a certain day, or I had a particular interaction with a patient or with a colleague, that I could draw something on. And I can't get it home to you guys enough how much Warwick just want to hear about how it affected you and how you felt about a situation. And you cannot underestimate it. They don't want you to just reel off the things that you did. You helped a patient with their hygiene, or they don't really want you to list off the practicalities of it. They want to know what you learned from it. So it's really important to keep that record, and not forget the details of those kind of things.
Katie, there's a few questions about what did you do during your hospice volunteering, how did you manage to get it, and how did you phrase it when you was applying?
Okay, so the way I got it to start with was I was aware that the charity existed. So it was a charity that had lots of shops around the local area, but they also had a hospice. So I knew they existed. So I went on their website and looked at the volunteer section and saw they were looking for care type volunteer. I can't remember my exact role name actually because it was a while ago, but it was something along the lines of volunteer care worker or volunteer support worker. So I just applied through their online process, filled in a form, got my references, all that sort of stuff. Had an interview with them and then did training once I got that position. I think with it being volunteer, you're not an employee, so the entry requirements are pretty low, like as long as you're a decent person and you can give like a character reference and things like that. They were fairly happy with it. The other question was, what did I do in the role? So I did about 4 hours every kind of week or every fortnight, and that involved a bit of a mixture really. So it wasn't really personal care, although I do remember one instance where they asked me to do some, although I hadn't actually been trained in it, so that was a little bit naughty. But otherwise, I actually was trained in manual handling, so I was able to help the patients. So the patients that were there were normally in wheelchairs and such, and weren't really kind of able to move themselves. So there was quite a lot of manual handling. So I was trained in that. So I was able to get them in and out of their wheelchairs, in and out of bed, with the supervision of one of the nurses and one of the sort of full-time employed care workers. But I chipped in with that. Other things I did was kind of keeping the patients company, so doing activities with them, taking them outside, helping to feed them, taking them to dining room, helping them at lunchtime and such. Kind of just being a bit of a friend, but it was kind of a blended role. Like there was some healthcare and there was some. It wasn't just literally sitting there chatting to them the whole time like a buddy. It was kind of healthcare related. Kate, was there anything else on that?
Someone did say, how did you phrase your hospice role?
Oh yeah, how did I phrase it? I think I in honesty probably did beef up the healthcare side of what I'd done more. But it was all honest because it's stuff that I had done, but it's not like every shift I was doing manual handling or personal care. So I just kind of what I've said really, explain like the hours I did, how regular it was, what I was doing each shift. I think I probably put in what I learned about it as well, and maybe kind of some experiences of things that I've seen, and kind of put the spin on it of how it impacted you, because it was children and young adults, and because they had terminal conditions, like it was quite difficult at times, particularly when people died. So there was a lot to reflect on in that role. Yeah, I learned a lot in that, so I could put that spin on it.
Thank you. Okay, then there's another question. A lot of work experiences for years 12s and 13s only. Should we still apply? I think still apply. Just message them and see. There's no harm in asking, and I think usually they're pretty happy to have a graduate as well because you're a bit older, and they tend to like it, to be honest. So yeah, I don't think that should put you off. Just still apply. I think we've done most of the questions. Does anyone else have any other questions? I know there's seen the one about the graffiti. I mean, I'm not completely sure. You would have to contact admissions, I think. For anyone's asking, you know, would this count? If it is hands-on care in a healthcare environment with people with healthcare needs, it will count. So I think an assistant psychologist, I think that would count. Does being a chaperone count for GP visits? It depends if it's for friends or family or people you actually care for. If it's friends or family, it wouldn't count.
And even it would only count as shadowing, so 20 hours max again.
Would flu clinics done within the employed role? I think it depends what the employed role is. What was you actually doing in the flu clinic? Because if you're just taking a patient to a flu clinic, that wouldn't count. Could you please explain for HCAs working in different wards and training to be a So, Banu, do you want to answer this one, or Callum?
Yeah, so in terms of training, it literally any hospital you join should be able to give you HCA training. This includes manual handling as well as basically what your job role involves. To be fair, my training was very limited. It's maybe half a day, and then you are basically chucked into a job. So it's more learning on the job rather than training. But once, literally, I think with HCA jobs, as they come, just apply, keep applying, and you should hopefully get an interview at some point.
Yeah, with the HCA jobs, the training differs hospital to hospital, trust to trust. So I think, like Banu said, you might have had like limited a couple of days. Mine was a month long training for the care certificate. Yeah, really good as well. But I mean, it differs from trust to trust. So I think you have to achieve the care certificate standard in any instance, but it differs massively. So when I did the care certificate through a domiciliary agency, it took 2 days, and when I did it through my hospital training, it took a month. So the level of training, the standard that you receive will differ massively from hospital to hospital and agency to agency.
Mm-hmm. And did you count the different HCA jobs and different wards as different experiences, Alan?
I did, yeah, just mainly because there was a gap between my first 9 months and my second 9 months. So obviously my manager was separate as well. So just NHS headed paper, you know, worked within this role in a patient facing centre, a patient facing role, and then signed by the line manager, because obviously it was in different wards, but it just looked a bit better as well if I had it in different wards, I thought, because then it looks like you've done sort of more than you have, even though it's the same amount of hours. But you talk about it a bit more as well, because obviously you've been exposed to different parts of medicine by working on those different wards as well, so it adds more to reflect on.
Okay, so how likely do you think GPs would be able to say yes to shadowing during summer? I wouldn't know because of COVID, but if you go on to that observed GP, you can do it virtually. So I think that's a shout to do that. Think of phlebotomists, that would count. I volunteered to help out at OSCE exams, that wouldn't count. It needs to be hands-on care in a healthcare environment. Is there a certain time frame? So it's from the 15th of October 2017 to the 15th of October 2021, but this varies for different unis. That's Warwick's time frame. Usually it's in the past couple of years. And then would St John's ambulance roles count? Yes, if you've got evidence of the hours and what you've done. How many hours is observed GP? I'm not actually too sure. I'll Google it.
That would count as shadowing, wouldn't it? So like 20 hours.
So I'm not sure how long does it take. Oh, okay. So I don't think observed GP would count. You would be able to get 20 hours from it. I don't think the program is as long as 20 hours. So it's probably worth doing stuff in combination with the other things. Will the hours of virtual work experience count as the same as actual? No, they're capped at 20 hours. Is grad medicine as fun as undergrad medicine? I wouldn't know. I haven't been able to compare it because I just do grad medicine. Would support autistic children with learning count as patient care? Yeah, if you are supporting them in a healthcare environment and they're not your friends or family, if you're doing it for an official organisation. If I shadow as a nurse, does it count? Yeah, for 20 hours. Will virtual GP observe count? I think it would, but it might not be, as you might not get the 20 hours out of it. You might have to do multiple things at once. Okay. So after, I think it's a couple of days, maybe a week after you apply to Warwick, you have to apply, fill in the form. And the form is just, I think you need to attach a reference, include the dates, and just talk about what you did in the role. And you need like a named contact as well. But obviously for the virtual stuff, just provide screenshots and whatnot. Okay, what if the nurse works for an agency? You need to make sure you're getting the evidence off the actual organisation rather than, it can't be your mum's friend or something who's a nurse, and you need to make sure it's from the organisation, else it won't count. Okay. Okay, so I think we've answered most of the questions. If you do have any other questions, you can message us on Instagram or email us at warwickwham@gmail.com. Just quickly, I'm just going to say about, we have an event for the entry exams, the admissions tests, and if you go to the WHAM versus Big Three, you can get a discount for Medify. And also we have an event next week which is about medical jargon and busting myths. So if you want to attend any of these, just scan this code, and it's on Eventbrite if you want to get a ticket on Eventbrite where you did for this event. And then also just a reminder that we have a buddy scheme where it's an 8-week buddy scheme where we'll pair applicants with current graduate entry medical students with Warwick, get similar backgrounds, so you'll be able to get one-to-one support and advice when applying to medicine. And that's it. But just quickly answer the last two. If we do DFE, then we can use any volunteering skills as part of naming the organisation. So I don't really understand that question.
No, so I did Gold DLV, but it's not, unless it was healthcare specific. If you were shadowing, again, counts as shadowing. If you were hands-on, it counts as hands-on. But unless either of those were ticked, then no. Hope that helps.
Mm-hmm. To get the discount for Medify, you need to go to the Big Three event, and you'll be able to get the discount for Medify. So I'll just go and then. So how do I apply for the buddy scheme? If you scan this link here, it will take you to a Google form, and that's how you apply to the buddy scheme. So I'll just flick through all the links again. So the Big Three is on May the 1st, and I think it's a Saturday. And if you scan this code, it will take you to Eventbrite. If you sign up for the event, you can get and go to it. It will help you with UCAT and BMAT and GAMSAT. If you're doing undergrad, it's probably just relevant with UCAT and BMAT. and you can get that discount. Okay, and then I'll just scroll back to the links for the virtual work experience. So, okay. So I think this is, so on here, this is the link for work experience for UHCW Trust. If you just Google these as well, it will come up. So this is for Spring Pod, and if you just Google Spring Pod, it will come up, and this counts for 10 hours, and there's the link for that. This is the link which includes all Observe GP, Medic Mentor, and the rest will be on, you can just Google. If you email warwickwham@gmail.com, we can send out the PowerPoint to you. I know you said give me the contact email, but I'm not sure what you mean, what contact email you mean. For Warwick WHAM is Warwick WHAM. I'll just, yeah. These are for Good Sam, but if you just Google it, that'll come up. Nightline Samaritans. And then I think that is all the links. Okay. So if you do want to fill in the feedback form, that would be really appreciated so we can help it in the future. Also, if you like our Facebook page, like Katie's just said, you can keep up to date with all our events. If you have any questions, you can contact us on any of these 3 ways. Okay. Thanks so much for coming. Yeah, I'll show the buddy screen. Hang on.
Thanks, Kate. That was great.
Thank you.